Okay. So, well, first of all, thank you very much for your kind invitation. I'm Juan Francisco Cabello from Chile, and we are here with David Urion from Boston. Thank you for the introduction. The idea is to share with you a 7-8 slide PPT. We put the slides in English and Spanish, but the idea is to speak in English, so don't worry. Actually, my English is not so good, but we will try to do my best. So and the idea is to start talking about this exchange program. We try to do something interactive in the second part of the discussion. We invited 6 fellows and former fellows from Valparaiso and from Boston. They will introduce themselves, and that will be the second part of this activity. And the last 20-30 minutes, we hope we will have enough time, to open microphones and discuss and receive questions from the audience. So that's the idea. So David, would you like to start?
Yes, delighted. And I want to thank our hosts for this kind invitation. And one of the things that you'll note is that of the fellows, 3 each from Valparaiso and from Boston, we have 1 representative from each group who is a person currently in training, 1 person who's a recent graduate of their particular training program, and 1 person who's been out for a while. So you can get a flavor of how people have reflected on these experiences over the course of their careers. So why don't we, in the immortal words of academic medicine, look at the first slide. So globalization has transformed the determinants of health, as well as healthcare delivery, I think, radically and irreversibly over the course of the last several decades. And this changing dynamic has, among other things, I think, led many trainees to become interested in global health issues. And despite this growing interest, medical education programs in many programs in many countries have really been unable to provide this in a systematic or organized fashion.
Yeah, I will take advantage of the Spanish slide, not just to read the slide in Spanish, just to add some comments. And I have to say, when we talk about global health and exchange program, this is what we try to find in the literature. But we have been doing this for 15 years. And personally, I didn't know I was doing global health. But I think that education and global exchange program are part of global health. And that's why I think it's so interesting to discuss the exchange program from the global health perspective. And we will try to demonstrate, the next hour, what about this relationship and how useful has been, not just for the Chilean side, but for the Boston side as well. So, and how we believe that this is a very powerful tool in global health, this exchange programs between education centers.
So we firmly believe on both sides of this bidirectional and quite collaborative exchange that the free exchange of ideas, experience, and perspectives is really fundamental to patient care, to training, and research. To give one example, of the 46 faculty members promoted to associate or full professor at Harvard Medical School in the Mass General Department of Medicine over the last 3 years, 40% were born in a country other than the United States. So we see that in a variety of settings, we live in a highly globalized world and experience.
Yeah, but regarding the Chilean experience, we don't have those numbers for a Chilean center like Mass General. You can see in this slide. And possibly in Chile, and most of the neurologists are coming from Chile. And if we have some immigration, people coming from other Latin American countries are working as a neurologist in Chile. So we don't have that 40% of foreign people working as a neurologist in our country. So our reality is completely different. So what we used to do when we talk about exchange is that people goes to US, learn something, and get back. But the main problem is when the people from Latin America goes to the United States and stay over there, because we are losing a lot of brilliant brains, that goes to state, find a good place like Boston and like many others, and they decided to stay. And that's something that we think is a real loss for our countries. So that's why we believe that this kind of bidirectional exchange program avoid that and try to keep the people in those own countries, trying to benefit as much patients as we can.
So this is a schematic of where students, residents, fellows, faculty, etc., come from.
Yeah. Well, actually, yeah, I just referred to one of the many papers that came out in the last 2 years regarding telemedicine education. And this is telemedicine education neurology, and this is just to show that we are not the first, we are not the only one. There are many other experiences, regarding foreign students, residents, and faculties interacting from different parts of the world. But again, as you can see in this map, and I think that's important part, is that there is an overrepresentation of, in this case, United States and some countries in Africa, but there are few examples in Latin America and in other parts of the world taking advantage of this kind of exchange programs, and in this case, telemedicine education in neurology.
And one of the things that we can just comment on that last figure is that it was a moment in time, but doesn't look at the issue of durability, which we'll get to in a few moments, given the long-standing nature of the collaboration between our two departments. So exchange programs between departments of child neurology in different parts of the world afford opportunities to residents to experience disorders or pathologies which their home departments don't see, and learn other ways of approaching familiar problems and develop and deepen professional relationships in an increasingly interconnected world. So we think all three elements of this are exceedingly important, certainly for our residents as participants in this program. That is, the exposure to certain disorders, which they may not see as frequently in metropolitan Boston, to see other ways of approaching a problem, especially ones that may not be quite as technologically dependent as American neurology has kind of classically become involved with, and then to develop relationships which are exceedingly important in our profession.
Yeah, and regarding the same thing, I think it's very important to point out that especially when the fellows from Boston came here to Chile, they found that we have the same kind of pathology that they used to see in Boston. But the approach is completely different regarding resources, regarding a clinical approach. So again, this exchange program is not to come to Chile to see tropical medicine or disease they will not find in Boston, but the teaching experience and the student experience, we believe, are completely different in one country and in the other. And not because one is better than the other, but they're just different. And we really believe that when the student and the professors are exposed to these two kinds, to learn, to different ways to learn, it is very useful for everyone. That's the main point.
So we think it's rather important that programs should be reciprocal, but not always equal, so that each program should be able to delineate what it needs to get out of the exchange. For example, in our instance, Boston Children's Hospital residents really were seeking month-long elective rotations that exposed them to clinical entities that they didn't necessarily see in Boston, and wanted the opportunity to be taught by skilled child neurologists who relied on their examination to a degree that most contemporary North American child neurologists no longer do. Chilean neurology residents, on the other hand, wanted the opportunity to participate in comprehensive review courses of child neurology, such as we offer in Boston on an annual basis, and also to participate in subspecialty clinics that their home institution did not have. So the exchange was designed to send Boston residents one at a time to Chile for a 1-month rotation, but to bring groups of Chilean fellows to Boston for a 1-week intensive review of child neurology, which the department runs, and then have them rotate through subspecialty clinics for 2 to 4 weeks before or after this course. So I think that an important element of these kinds of exchanges to be successful is that reciprocal doesn't always have to be equal in order to be equivalent.
So not many things to add. I think David said everything, but that's something that we realized over the years, possibly in this exchange program. Again, trying to highlight that this is not, that we are not equal. And what we discussed in the previous slide, this is not that we believe that one is better than the other, it's just different. And that difference, that diversity, we believe is very important for the fellows to know and to value what they have in their own place, and to value as well what they don't have. So again, I think that's very, very important, and it's a central concept in our exchange program, that we are not equal, but that doesn't mean that we could not be reciprocal. So that's a very important point.
And exchange programs, we also feel, can be a source of both faculty development and formation. Chilean fellows have come to Boston Children's Hospital for more formal subspecialty training, which has included training in behavioral neurology, neurogenetics, and epilepsy neurophysiology. These persons have then returned to their home department with subspecialty training and helped develop both clinical as well as research programs in those settings. The advantage for BCH is a group of international trainees better known before they began their training and with whose home department there is an ongoing relationship.
So same thing, but related to professionals in this sense, because I think the benefits that we can reach with this kind of exchange programs is not just for the students and not just for the students who travel from one side or the other, because when they go back to their places, they benefit his fellows that didn't have the opportunity to travel, and of course we benefit different professors in different programs. So that's again the same thing. This is not the same benefits. There are different benefits, but they're beneficial for both sides anyway. So I think that's important to highlight on this slide.
Child neurology overall as a discipline is helped by expanding the relationships. The connections established between residents are likely to develop into useful professional connections as time goes on. The two authors of this presentation first met when one of us, JFC, was a fellow in metabolism and genetics at Boston Children's Hospital. We reconnected during a continuing medical education course that I was running at the time, and then hatched this idea for this exchange when I was first invited to Chile for a CME course run by the National Pediatric Neurology Scientific Society.
Yeah, and I think this is very interesting regarding, we had a long discussion with David about this, about the way that we used to create or to develop networking. That word that for you is something very formal, for in Chile and in Latin America and many other countries, it's much more informal. So I don't know if I'm allowed to say this, but we developed not just a professional relationship, but a friendship, with David and with all the people, in Boston. And for us, I understand that not for you, but for us, that's essential in an exchange program. I mean, we develop a personal relationship with people, and that friendship is, at least for the Chilean side, an important part of this exchange program. I mean, without that networking for you, friendship for us, it is impossible to make this sustainable over time. Sorry, David.
No. But all reputation and rumors to the contrary, Bostonians actually value friendships as well, and I value ours enormously.
I mean in a different way.
Despite our frosty reputation.
Okay, we'll go for the next one.
So this exchange program has been in place for 15 years now. And over that period of time, 80 residents have participated. 3 post-residency fellows have been trained in Boston. And we've shared in teaching more than 10 graduate and postgraduate medical education programs variously in Santiago and Boston. Both training programs have found the exchange to be an incredibly useful instrument in recruiting our own trainees because of this robust nature and actually now sufficiently durable that I think we count on it as a standing and important part of our program. Juan Francisco has actually just finished a sabbatical with us for 6 months and actually is now on our standing faculty, which is a source of pleasure and delight.
Well, yeah, I think year after year, we just realized that this exchange program just grow up not just in the number of people benefited with the exchange program, but in the kind of activities that we develop. And possibly the first time we discussed this with David in Boston in 2004, we didn't imagine, how this grow up and how many people, in how many ways people will be benefited. So numbers for us are very impressive, regarding that we are just 2 programs, and the kind of activities that we develop over the years has been growing up in year after year. So again, I think that this exchange program is a very useful tool, not just for students, but for the faculties and everybody else participating in our fellowship program.
So the activities in which we engage include monthly video conferences that have been going on long before the pandemic hit and all teaching became by video. So we have a monthly conference in which patients with various neurometabolic disorders are presented, and the 2 groups of residents take turns presenting unknown cases to one another. And then having the group of residents that doesn't know the patient walk through the case together and go through the reasoning process that their counterparts in Chile encountered. Because of the minimal time difference between Boston and Santiago, sometimes no time difference at all, this has been very easy to facilitate. We've already talked a bit about the fellow exchange and the faculty exchange, of which there have been clear examples. Several Bostonian faculty have gone down to Chile, and we've had several faculty come up and join us, which is wonderful. We've done work together, and this has led to academic publications shared between the 2 institutions. And we have participated together and collaboratively, not only in one another's meetings, but together in other international meetings as a cohort.
Yeah, so that's a list of activities that we just discussed, and as David said, has been amazing, to see how many activities that we developed in the last years and how this list grow and grow and grow and grow up. So that's why we believe that this is the formal activities. We have many other non so formal activities that are very useful as well, especially when the fellows goes there and when the fellows come to Chile. And I think those activities are very important as well to make our relationship more and more tight. So so this is I think this is the last one, the last slide, and we would like to share in the first 20 minutes. We are on time. So and this is the list of panelists that we invited today. As David said, there are 2 fellows, 2 former fellows from the last few years, and 2, I will not say older fellows, but fellows that are for a while already working in as a neurologist in different places of the world. So the idea that we discussed with the panelists, that they will introduce themselves. They will have 3 minutes each one to tell you what are they doing today, who they are, and how the exchange program impact on her or his educational career. So maybe it could be a good idea to start with the younger ones, not in age, but the one who are today fellows. Maybe then, Chris and Jose Ignacio, and then maybe we could follow with Vicente and Annelise, and to finish with Karina and Claudio. I don't know, David, if you want to say something before the introduction of the panelists.
No, I think we should let them speak for themselves.
Excellent. So, Chris, Jose Ignacio.
So hi, I'm Chris. I'm Chris Riskaboff. I'm currently a 6-year neurodevelopmental disabilities fellow at Boston Children's Hospital, and I'm also concurrently a Zuckerman Fellow at the Harvard Graduate School of Education. I actually first went to Chile when I was a medical student, and 6 years ago, and I was working there, or rather shadowing at Roberto del Rio, which is one of the hospitals in Santiago. And then I got to spend some time as well at the INTA, which is the Metabolic Institute. Then 2 years ago, I took from Annelise, who you'll hear from in a minute, the patient presentations that they were talking about of each Boston and then Chile alternating between who presents the patients. And so I took the lead from the resident side of coordinating that. And then actually when Dr. Cabello came for a sabbatical here, we started a new program that I've been working with him on called Patients and Pathways, where we have 30 minutes of didactics on a neurometabolic disorder, and then subsequently 30 minutes of interview with the patient and their family, which has been a really great experience in terms of understanding the patient side of things and their experience of these rare diseases. In fact, today, we actually earlier today had a talk on PKU. And so that has been really fun collaboration that I've learned a ton from. In terms of the other things, so, I think it's been a really great opportunity as a resident to be able to build these relationships like that DKU and JFC we're talking about, because out of this, I've actually started working with a group from Valparaiso to look at infantile spasm relapse. So we're doing some research together, hoping to get some publications, and really, having this amazing opportunity for equitable research between the two institutions as well, that we're getting to learn about each other's patient populations. So that was the main things that I was going to talk about is, I think as a resident, the opportunity to participate in a program like this has been really invaluable, both from seeing how an equitable collaboration can be built, which is so important philosophically, as we learn and think about how we would like to build our future careers, but also just getting to build these relationships with some pretty amazing people. I don't know if Jose and Ignacio, if you wanted to go.
Of course, I am Jose Ignacio Leiva. I am a third-year pediatric neurology resident in University of Valparaiso. I first studied medicine in Santiago and then came back here to Valparaiso to enter this program. One of the things that I thought at first when I was choosing what program to enter, and this was one of the elements that differentiate this program from the other ones in Chile, this exchange program. When I started my training, the pandemic also started. So maybe my experience have been a little different from the other experiences you're going to hear, such as, for example, Vicente or Karina. But it has been a wonderful experience regarding mainly the neurometabolic case discussions that we do on a monthly basis. They're very interesting, and it is so good to see how another group of people who do the same thing as you think very differently. As Dr. Cabello said some minutes ago, it is something interesting in comparing how mentally we do a diagnosis, for example, and all the differences that you can see in that process. Mainly all my change activities are going to be online, but this year we're looking forward to know some residents from Boston who are coming here to a Congress in November. So we're looking forward to it. And you can see that even in these times where when everything is online, and that has been so different regarding other experiences, we can have a wonderful time sharing with some people that's across the globe, and very, very useful in our training. So it has been a wonderful experience. I'm looking forward to see you guys on November.
Hi, everyone. I'm Annelise Hoff. I'm currently Zooming in from Lima, Peru. I've been having some internet issues today, so I apologize if I drop out at some point. But I'm here in Lima doing a NIH Fogarty Global Health Fellowship through the Harvard School of Public Health. I've been conducting research here on neurologic aspects of COVID, as well as some neurocysticercosis projects. I will next be heading to the NIH for a fellowship in neurovirology and global neuroinfectious diseases in about 3 weeks. I graduated from the child neurology residency program at Boston Children's a little over a year ago, and I was heavily involved in the Boston Valparaiso neurology trainee exchange program while I was there in residency. In my first year, when I first learned about the opportunity, I decided to spend my entire elective month in Chile rotating through the child neurology department at the Carlos Van Buren Hospital in Valparaiso, as well as through the Metabolic Disease Clinic in Santiago. And during that time, I got to learn about the health system in Chile and had an incredible training experience rotating with the residents and attendings who treated me like family during that time. My then next 2 years, I acted as the Boston resident leader of the exchange program's monthly lecture series, where I was able to maintain those relationships with those that I met while I was in Chile. I then took those relationships and was able to be co-involved with webinars, collaborations on projects, publications, posters. So through this experience, I was taught the value of international collaboration and clinical learning that crosses borders. And during the pandemic, realized the absolute necessity of these types of relationships. So though I already had a pretty strong interest in global health prior to this experience through my public health background, it was through this, I can honestly say that my desire to then devote a career to global neurology was really dependent on this experience during my residency. And I hope to devote more of my career to maintaining a personal objective of international collaboration and information sharing. Thanks.
Hello, everyone. My name is Vicente Quiroz. I am a pediatric neurologist at Hospital Carlos Van Buren in Valparaiso. And I would like to go back when I was a med student. Back in 2014, and I was on my first child neurologist practice, and I saw that the residents were talking about a trip to Boston. They were talking about meetings with people at Boston and how they developed this relationship. And I was very excited about it, about hearing that. And I thought at that point that I found what I was wanting to do in my life. So I decided to study pediatric neurologist at the University of Valparaiso to meet a wonderful team. And that team always pushed us to do more, to test ourselves. And I think that this exchange program allows you to do that. You are studying pediatric neurology in Chile, you are testing yourself, you are learning about physical exams, advanced techniques, different diseases, and then you get to try and get to test yourself with a student from another country, from another health system, and you see how you're doing. You try to push yourself to excellence, and you have to do it better and better every time to keep this relationship going, to learn about the others, to learn about new things. And I think that one of the most important lessons that I have learned from this experience was the bioethics aspects that we always included in our conference. We didn't only talk about ultra rare disorders. We didn't only talk about neurometabolic diseases. We also talk about how to talk with families, how to develop bad news, how to keep in contact with families even after the patient has died, how to do enough life care in these patients. And I think that is one of the most important reasons why this global perspective allows us to become better neurologists in this time, and how we can help other countries now, and how we can project this exchange program, not only between Chile and Boston. Wherever we go, we will always think about these times, and we will try to develop new projects in new places and include more people, because we want this experience to be known by everyone. Thanks.
Good afternoon, everybody. My name is Carinia. I'm Chilean. I studied medicine, and then I did my specialization in pediatric neurology at the University of Valparaiso from 2008 to 2010, during which time I had the opportunity to participate in the exchange with Harvard University. I think I'm the older from all the residents here. First, I stayed 3 weeks as a visitor in the different units of the pediatric neurology service at Children's Hospital in Boston. That was an amazing experience for me. After that visit, I began to value even more the formation of neurologists in my university, which, although suffering many lacks in terms of technology and equipment, provide excellent anamnesis and physical examination. At that time, I was just in my first year of specialization. During my second exchange in 2010, I went to the Michael Bresnan course again, and I stayed 1 month just in the epilepsy unit, where I learned the functioning of a long-term monitoring unit for the first time. They included me as one more fellow. Actually, I had the opportunity to make a presentation, and I was able to accompany to the two top experts in their clinics. My experiences in Boston motivated me to continue my studies in epilepsy. Without a doubt, my experiences made in the Harvard Children's Hospital have both encouraged and underlined my continued studies in epilepsy. In 2014, I decided to pursue studies in epilepsy at the Pontificia Universidad Católica de Chile. Since my specialization, I've been working as an epileptologist in 3 public hospitals in Chile. I worked 4 years at the Hospital Sotero del Río, which is the biggest hospital in Chile. And there we began to develop the epilepsy surgery, and I'm very glad to say that today this is the first place for public epilepsy surgery in our country. In 2019, I came back to my city. I have been working at the public hospital of Valparaiso. And since 2019, I've been part of the board of directors of the advisory group of epilepsy of the National Health Ministry, where I've been part of teams that have developed and improved policies for the National Ministry of Health related to epilepsy, especially in capacitation, access to right diagnosis and treatment, no matter their incomes or place of living. Although I was one of the first students in the exchange programs, this relationship has continued to grow and strengthen, continue to provide even closer links and collaboration between fellows. Actually, during the last month, we have been working in a collaborative research about SPAS with Christine. Thank you so much for your time and the opportunity to share my experience.
Is it my turn now? Okay, sorry, I wasn't sure. So hi everyone, my name is Claudio. I am a neurologist, and I did subspecialty training in movement disorders, and I'm also into the intersection of movement disorders and genetics. And thinking about like what to say, and thinking about the experience I had as a trainee and visiting Chile, and that was back in 2013, so a while ago. I am somewhat of a visual person, and it was a very it was experience rich in details. So I prepared a few slides, not very long, but I thought I could share this a little bit better if I shared a few pictures of my trip instead of just talking about it with verbal. Would that be okay? So let me share my screen with everyone. And here it is. So I wanted to summarize what my experience was, and I really like this sentence by William Osler: "He who studies medicines without books sails an uncharted sea, but he who studies medicine without patience does not go to sea at all." And I think this is like the sentence that summarizes why I went to Chile. And essentially, I wanted to broaden my horizons. I wanted to go to sea. This is the view from Valparaiso, and I feel like the experience of going to an overseas exchange program is about expanding your horizons and deepening your knowledge about the things you think you know, but you actually don't, and then knowing about things you didn't know that you didn't know. Since this is a talk about an exchange program in neurometabolism, I had to put together a little metabolic sequence of the neurology trainee. So I think the neurology training is about expanding your breadth and expanding the depth of your experiences. And I think both programs in Boston and in Chile offer this breadth and depth in their own ways. But the ways that they do it are different, and therefore the experience is very rich because you gain this breadth and you gain this depth in different nuances. In addition to the education experience, you have the travel experience. This is a picture of the INTA that I visited with Dr. Cabello, and this is the honor I had of meeting Dr. Novoa and Dr. Colombo, who are very, very deep neurological knowledge figures that it was an honor to meet with them. And then I participated in the course in 2013, the 12th neuropsychiatry course. And then I had the opportunity to talk at this course in 2021, last year. So in all, this experience has expanded my horizons in so many levels and led to so many collaborations from going to case discussions with Juan Francisco, then to meeting other neurology Chilean colleagues, and thinking about future things. That I think that this is such a formative experience for anyone who wants to broaden their horizons, to leave your training place and go somewhere else. So that's what I wanted to share.
Okay. So, yeah.
Wonderful. So I wanted to first off thank each of you for sharing with all of us such an impactful and meaningful experience and program. It's really inspiring to see what you've been able to accomplish in creating such valuable experiences for trainees that have clearly impacted their future growth, development, and careers. And so now we can go ahead and start with some questions. And I'm going to raise the first question, and others, please feel free to continue to ask questions in the chat. So the first question I ask is for those, the program sounds wonderful. And so I'd love to learn any tips that you have for how you garner buy-in from the departments for support and resources and developing similar programs, and any challenges you might have faced in doing so.
So I'll dive in from the American side, you know, obviously there are some challenges at the level of financing things, especially for resident travel, because one of the things that we very much wanted to do is to make this available to any resident who is interested, not people who are somehow separate from their residency, independently wealthy. One of the advantages that we have is that there's concomitantly a program that the hospital runs that are essentially for mini fellowships for faculty that come from all over the world. And in order to participate in that, those persons, their home institution pays a fee to the department that's sponsoring them. And so we essentially use that as a recycling program, so that the funds that come into the department that we get for educating faculty members who come from all over the world, we actually plow right back into sending our own residents to various places, not just to this program, but to any of the various things that our global neurology track within the residency does. So that's a primary source of funding for the resident exchange in terms of that direction. In terms of other parts, I think that this was one of the great advantages is that the two chairs for whom I've worked in Boston over the life of this program were both deeply committed to an old notion that neurology is an international family. And we're deeply committed to the idea of strengthening any ties that we possibly could, especially in the world that we so often find ourselves in. So I had the great advantage of two chairs who required no kind of sales job whatsoever. They mostly asked me what did they need to do to support this.
Yeah, regarding Valparaiso side and Chilean side, because I have to say, to this exchange program, the benefits have expanded not just to Valparaiso. In Chile, we have four universities, but seven actually, education programs, pediatric fellowship program. And fellows from all the programs, not just from Valparaiso, goes to Boston for this continuing medical education program, the Michael Bresman course. And all of them, rotate in the different units. So this is the link is with the University of Valparaiso, but the fellows from all the centers are benefited by this exchange program. So every center has to solve the economical challenge. Again, reciprocal, not equal. The fellows here in Valparaiso, they used to work, to make some money, and we have a common fund for the fellows. And from that fund, they have some money to pay some expenses, but most of the expenses of the fellows traveling to Boston are paid by, out of pocket. But even that, we send every year, the year that the more fellow travel, we're like at 2021. So it's not a real limitation today. Of course, it's a challenge. And one of the next steps that we would like to improve, of course, is to have a formal financing of this program. But I agree, it's a challenge, but it's not a limitation. It's my feeling, I mean, if you want to do it, you can do it from Chile and of course from Boston. So I don't think it's a limitation. It's a challenge, but it's not a limitation.
Thank you so much for sharing how you went about securing funding for creating and supporting the program. I guess the next question would be, what obstacles did you face aside from the funding in creating the program that others who are interested could potentially anticipate?
So one of the obvious obstacles that comes from the American side of this is that most Americans don't speak anything other than English. And one might have the opinion that actually many of them don't do that very well. But that's a real problem, and that has nothing to do with medical education. This starts long before. But America has sort of abandoned the notion of educated people speaking more than the language with which they grew up. And so I think that our hosts in Chile have always been incredibly kind. But I do think that for those of our residents that go that aren't bilingual, there's a loss of something because in fact they become dependent as they are in the same settings here in the United States on interpreters, their colleagues, etc. And there's something that's lost when you don't get to speak to the patient directly. So I'd say that that's a beginning obstacle. I'd be interested in what any of the folks from our side that went also found to be an obstacle.
Regarding language, some things, something like that, but the difference is that in Chile, most of the medical students from the medical school, we used to study from books and papers in English. So at least we understand the English, and some of the Chilean students and postgraduate students has better English than others, of course. But yeah, actually for us, and we have to recognize this is a good opportunity to train our English. We used to organize with our fellows in Chile, besides the activities with Boston Children, some activities in English. Actually, for quite a long time, we hired an English professor, and a professor went to the hospital like weekly to for English classes. So this is another benefit, for the. It's not an obstacle; it's a benefit because this exchange program forced to our fellows to learn English and to practice. So again, so this is Claudio showed the picture of Dr. Novoa and Dr. Colombo. They are my mentors and mentors of most of the people here from Valparaiso. And Dr. Novoa used to say that we need to transform the obstacles in opportunities, and that's exactly what we try to do every day in our clinical practice, but specifically regarding the English and the Spanish. So again, I don't think it's like when we talk about money, and I say this a challenge but not a limitation. This is an obstacle, but at the same time, it's a great opportunity for us, to practice the English and to develop our English skills, and has been very, very useful. Let me say that. And I have to say that Chris, Claudio, and Annelise, and David, they speak perfect Spanish. So actually, next time we can do the seminar in Spanish if you like.
That would be a great test for all of us. No, the language is a critical point, and so thank you for bringing that up as well. And so if there's any other questions, please feel free to bring them up, and if any of the panelists as well have any additional points or questions they wanted to bring up, now is a great time to do so.
While we wait for more questions, I would like to add to what Juan Francisco was saying, that from Valparaiso, from Chile, we understand the commitment that we have with this exchange program. So when we work month by month, and we prepare when we are in second and third year of our residency program for this travel. So we know from day one that this is something that's going to happen, and that we will visit Boston, and that we also been knowing and meeting all the residents from there since day one, as I say. So when it comes that you have to pay for a plane ticket, or you have to pay for an Airbnb or a hotel or something, you understand the meaning of that. And perhaps it's a big expense, but you don't mind, because you understand that what you're getting from it is much more than a couple of $100, but it's very, very, very important for our training, and we understand that. And also, most of us don't have the best English, we don't have the best pronunciation, but we've been training, we were preparing, we understand what when we try to communicate. And I think that it's a barrier that we have to face, and it's one of the other skills that we get training into. And as I say, it's the commitment, and you have to believe in in it. You have to have further goals. You have to accomplish more, and we have to test ourselves day by day by doing this. And we have to keep this seed growing and growing. And we can see how Karina, how Claudio teach us as we were residents, how much they have gained from this exchange program. And that's the main goal and the message that I want to give to future pediatric neurology trainees.
Thank you for that. So we have two additional questions. So one is, Dr. Urion, if you could weigh in on the specifics of the funding, and in particular, if Boston Hospital covers the salaries of Boston residents who travel to Chile, and if there's been any challenges from GME in the travel and in doing so.
Yeah, so we already talked about how it is. We basically have the Robin Hood kind of approach to funding the actual travel in time for our residents. Our residents actually in the child neurology and NDD training programs have a total of 6 months of call-free elective over the course of 36 months of child neurology, longer in terms of NDD. And because there's this call-free elective, it's paid for, so one still gets a salary, but you don't have to worry about sort of bunching up all sorts of overnight call, et cetera, in order to get a block of time sufficient in order to go there. This would probably be a challenge in a smaller program where it would be difficult to establish, or more difficult to establish call-free elective time. But that was the means whereby, and then it was covered, as I said, because the salary for call-free electives is still the salary that comes out of the overall salary hopper. In terms of other GME challenges, no, I don't think so. I think that this was viewed as a completely appropriate and actually very interesting elective. Our GME office here at Boston Children's has been equally supportive of this whole endeavor. In both directions, actually, bilaterally. In some ways, this is one of the things for which overall, what's a relatively small residency in a large hospital such as Boston Children's, nonetheless, sort of hits way above its weight, to use that American turn of phrase, in terms of global health efforts on part of the hospital overall.
That's wonderful to hear that Jimmy was so supportive. And it looks like you've successfully recruited people. And so one question is the rotation open to pediatric neurology residents outside of Harvard? And how can one coordinate that rotation if interested in Chile?
Yeah, we actually haven't done that yet, and actually now, as I'm no longer residency training director, I couldn't actually speak out of turn. It's an interesting concept, and we should probably stay in touch. Although I'd be much more enthusiastic about helping other people set up a similar program from their residency, because I think that one of the great advantages is not just the exchange in and of itself. And I want to speak for our trainees or the Chilean trainees, but it's this sort of deeply embedded ongoing monthly set of conferences. I think that that's one of the things that makes this different compared to other exchange programs. We are in each other's lives as training programs absolutely all the time. And so I think that actually helps. And I think several of the trainees from both places and former trainees have emphasized that. The idea that this is really kind of part of the warp and woof of the two training programs. And that may be part of the secret sauce.
Yeah, from the Valparaiso side, if you want to come, I don't know, Anonymous, you are more than welcome. Actually, as David said, that one of the ideas of this webinar is to inspire other people to reproduce, not in the same way, but possibly with different realities, with the different conditions of an exchange program. But the idea is to expand this and to reproduce, because we really believe this is something that has a lot of benefits, not just for the people participating, but for many others, especially for the patients. We used to say that, all the fellows, former fellows who spent some time in Boston, or who spent time with the fellows from Boston who came here, those are benefits that the patient at the end of the day will receive. And that's the most important part for us. So again, we really believe, that if somebody else would like to come to Chile or would like to go wherever, it will be very useful for them, but especially for the patient that they will have to attend in the future. Something again, we used to say that regarding people from Boston coming to Chile, but we understand it's the same from Chile going to Boston, is that the thing that we value the most from our fellows is when they have interest to learn. We used to, Dr. Noah, our mentor, used to have a fellow profile. And the first point of the fellow profile is that we expect from them is the interest to learn. So when you take a plane, you travel 10,000 kilometers and you came to Chile, it's because you want to learn something, So and that's something what we discuss with all the fellows who came here and with all the fellows who goes there. So if somebody has interest to learn, please, you are welcome to contact us in any way, and we will be happy, to receive you and to promote this kind of exchange program, because we really believe they're very, very useful. Again, not just for us, but for all the patients that we'll have to see in the future.
I think it also provides at least the beginning of some kind of way of trying to reimagine what international collaboration in child neurology education would look like. Unfortunately, one of the side effects, I think, of American programs opening their doors, as we alluded to in an earlier slide in our slide deck, to international trainees, tends to be a brain drain. People will come here and train for 6 or 7 years in something, and we like them, and therefore, we have been greatly guilty of, instead of helping educate people for a larger workforce in neurology across the globe, we tend to essentially appropriate them for America, and that's not good for anyone. It's certainly not good for the countries from which they come. And so part of this is now thinking about what our next step would be is, how is it that we could reimagine a collaborative model of medical education across I won't think, I'll think more humbly than across the globe. I'll merely think across 2 continents or a hemisphere, right? How could we reimagine what American, in the real sense, child neurology education across North and South America might actually look like in a more collaborative and less appropriative framework?
And we have time for one more question, and we'll try and sneak in here. And so this is a question of, do fellows, when visiting other sites, just observe? Are they fully integrated and able to provide patient care when visiting in Boston? But I think it's also relevant for when in Chile.
Sure. Juan Francisco, do you want to start from the Chile side, and I'll then handle the Boston side?
Chile side, there is no limitations, legal limitation actually, and regarding the daily practice, and I think Claudio or Annelise can answer because they already came, and so but yeah, they are fully integrated in Chile. They can see patients, and actually it's what we look for, that they will be exposed, to the relationship with the families and with the patient. I don't know if Claudio and Annelise want to say that it's not true what I'm saying. Yeah, but we try to fully integrate them in the care of patients, and most integrated, better.
I will say, I think one of the most beneficial aspects was the full integration into the educational aspect. I was very welcomed into all of the resident lectures, journal clubs, was able to participate in rounds every morning. Also the clinical aspect, going to the metabolic center. So I think it was mainly the educational piece that was extremely helpful for me as a visiting resident.
I agree. Sorry, I agree with Annelise. I think that as a resident, you're soaking up as much knowledge as you can. And this exchange program it addresses an educational need, not a service need. So you can be integrated into patient care. But as a resident, what you're most interested into is the benefit of the patient. And if you're coming to a new service and you're just getting there, you're also worried about how things are done and doing things. So you're also careful. So I think it serves it better for it to be an educational experience with the company of someone else who actually knows the system and knows the patient better, and you're just visiting. If this was a longer program, perhaps it would make sense to also have a service aspect to it. But my take on it as a resident, that's similar to Annelise, is that it was much more fruitful as an educational experience.
Yeah, by American regulations, obviously, if people have not passed a whole variety of American examinations, they're not allowed to touch or examine patients. However, they're completely incorporated into the visit itself. Most of the Chilean fellows who come and visit with us are actually participating in faculty clinics as opposed to basic resident clinics. And so therefore, for example, if they're hanging out with me in the office, we're sitting there talking with the patient and the family themselves directly. I'm doing the hands-on examination, but they're there in the office with me. We can ask our Chilean colleagues who experienced this if they viewed this as a significant impediment, back to Claudio's point, as an educational experience. And again, we'd emphasize the idea that this is not for service, but this is for education and training.
Wonderful. Well, thank you all so much for your time and sharing the experience that you've had in developing and taking part in what sounds like such a wonderful program. And thank you for all the listeners and attendees who stayed on to the end. We'll go ahead and end the recording here, and hopefully everyone has a wonderful rest of the day.